So now we're going to be doing hip extension. Introduce yourself to your patient. We already did that. We already decided what her affected and unaffected side was, and her unaffected side was a 4 out of 5 or a 5 out of 5. So now we're just going to test the affected. So Abby, if you wouldn't care to lie on your stomach.
You pump it up to get your estimate of how high you have to pump it.
We're going to say that her left leg is the affected side. So again, we already tested that right side. We said it was 4 out of 5, 5 out of 5, perfectly fine. So now we're going to stabilize. So you just want to cue your patient to keep their legs straight and then just lift it up as much as they possibly can. So Abby, just keep this leg straight and lift it up as tall as you can. Okay, is that as high as you can go? Okay, you can relax. So you want them to be completely relaxed, stabilize at the pelvis. Now I'm gonna see if I can move you a little bit more. Passive range of motion and bring her down. So since she had full active range of motion, now we're gonna go ahead and test here. So you want her to be that leg straight, lift it up to about here, and then you apply that resistance to the ankle. So cue your patient. Abby, don't let me push you down. Hold, 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 and relax. So she sustained maximal resistance, so we're gonna say that that is a 5 out of 5. But let's say that she couldn't do it. Let's just say we had to put her in a gravity minimized position. We're gonna have Abby lay on her unaffected side. Okay, so you're gonna bend this bottom leg just for stability, just whatever's comfortable, and then this top leg is gonna be straightened. You're gonna stabilize here at the pelvis, and then you're just gonna use this, my left hand, you're just gonna use that to be a shelf. So instruct your patient, Abby, I just want you to bring your leg back as much towards me as you can. And again, you're just shelving. Is that as far as you can go? Okay, now completely relax. I'm gonna do passive range of motion. See if I can't move you further. All right, so her active range of motion was very limited here, so I'm not gonna test for resistance. If I did test for resistance, then I would use the heel of my hand, stabilize, and I would say, don't let me push you forward. Oh, that would be if, you know, if her passive range, or if her active range of motion and the gravity minimized had been full.